Hi, everyone. It's Dr. Jennifer Butler coming to you live from Orlando, CEO and founder of House Concierge MD. Definitely want to talk to you about a topic that is always high on the list between myself, with friends, families, and clients, and that is obesity and weight management. And it's a topic that's resurfaced recently after Oprah just did her weight loss special. And I think the major key takeaway that I want to put on the table as we have this conversation is around the fact that obesity really is chronic disease that is incredibly complex. It's multifactorial, it's multi-layered, and it has a huge element of psychosocial components to it. And I think when we really think about obesity with regards to having just excess weight, on a physiological level, what's really happening is that an individual has excess fat in the body that's promoting some tissue dysregulation that's causing, as a result, some adverse metabolic, biomechanical, and in turn can have some psychosocial health consequences. And people will report that sometimes, perhaps among family, among friends, and social environments, or even professional settings on the job, there's stigma around weight. And it can be internal stigma in terms of how you view yourself and how you view your body confidence. But it's also implicit or a rather explicit stigma, explicit bias that people do experience externally from others. And so ultimately, I want to talk a little bit more about obesity, how it's measured, and why it's important to have an individualized care plan. And so the most common metric that we use to measure obesity is the body mass index, also known as the BMI. And you find it in five major categories. And so for most people, when we talk about BMI, normal weight is between 18.5 and 24.9. And then if you run between 25 and 29, then we start talking about being overweight or being pre-obesity. Class 1 obesity is usually if you're between 30 and 34. If you're between 35 and 39, then we start talking about class 2. And then if you're 40 or more with regards to your body mass index, then you're considered to be in class 3 obesity. But I think what I really want to drive home, and I can't be more and more redundant about this, is that obesity is incredibly complex and it's multifactorial. You have genetic factors, you have environmental factors, you have endocrine factors, you have medical factors, you have neurobehavioral factors, you have immune factors, and they all come together to create this intricate integrated web that really impact weight loss and what goes on in the body and how people on a day-to-day basis are able to manage and achieve their weight loss goals. And so ultimately, I think it's really important that if you're struggling with your weight, to connect with your doctor and have a conversation about your individualized care plan, because management of weight is not a one size fit all solution. We here at House Concierge MD definitely believe in a patient centered approach, and we're more than happy to have a consultation either by phone or over Zoom to discuss what your individual care plan should look like, how we can do a holistic wellness consultation evaluation to ensure that you achieve your goals. So give us a phone call at 689-444-5086 or follow us on our website. And I hope we can talk more about this and keep the conversation going. Have a great day. Bye-bye.